think once you've seen Indigenous patients who are very young having diabetes, having heart attacks, having all sorts of vascular problems, as we see in this setting, it really gets your radar working, and you have to apply the screening tests at an earlier age than you would elsewhere. Greg? This morning actually, a patient of mine called Greg is coming back to see me. I saw him last week. We were discussing diabetes because he has a few family members with the disease, and we did some tests in fact, and today he's coming back to have me tell him, unfortunately, that he does have diabetes.
Oh, I hope you got some good news for me.
All right. Well, look, yeah, last week we were discussing diabetes, and because Greg is getting on into his late 30s, almost 40 now. Quite a young man for someone to be diagnosed with the mature onset type of diabetes. But being an Indigenous man, he has an extra layer of risk, we might say. He's not a big man, he's not the shape that makes doctors think, well, that person's a sitter for type 2 diabetes. But I guess it goes to show that being Indigenous and even just being a little bit overweight, they are risk factors enough to actively look for diabetes.
Can it go away? It's going to be there after?
It's something that will be with you for life. But before we get too far ahead of ourselves, I'd like to go back to sort of explaining what diabetes is all about. You've probably It's very important to actually make sure the patient knows the consequences of having poorly managed diabetes. And, so we're talking about problems with the feet and problems with the eyes in particular, but there are also problems as, with the heart and kidneys and brain. And that's a good starting place then to say, well, what can we do about it? How can we prevent those things from happening?
Okay.
If we're going to move forward now and manage this effectively, we want to involve some key people in helping you to manage it. It's important simply to have a very explicit, listed plan of what's going to happen next and with whom, so that everyone knows what's going on and nothing is overlooked. In the first instance, I referred Greg to the Aboriginal health worker whose specialty is diabetes, and Louise has a very good understanding of the disease and can talk to Greg about that in a way that make it easier for him to understand that perhaps I wouldn't be able to do so well. So he's in the waiting room now.
So you want me to have a little chat to him?
If you could.
So what have you been through with him?
A bit about... Apart from that, obviously being Indigenous herself, she has that sort of innate cultural awareness and ability to attend to perhaps slightly different issues that would be different from my perspective.
Just a question, did you understand what Dr. Bill was talking about?
Yeah, I did, yeah, but just he told me that there's ways of controlling it, and so I just would like to talk about what things to eat now. And
okay then, so when a patient like Greg or any of my patients come to me, I would normally talk to them about diet changes, exercise, and the complications that diabetes can have in the long run if their diabetes is not managed. Did he put you on any medication?
not as yet.
No, so that's good. So we're just going to go on diet control at the moment. Yeah, you've got to try and focus on the first thing. Like Greg today, really about his diet changes, because it's a big shock to their system, like they're coming in newly diagnosed, and you try and tell them all these things, they're just going to forget about it mostly because they're still in a bit of a shock. You might just have to explain it a bit more in simple terms. You know, your diet, and well, next time you go shopping you might want to look at this and say, well, you know, go at the back here and say, oh, on my shopping list I might choose from this today, you know, on the shopping list, and your different choices. One thing too I do encourage is that they do get a glucometer so they can measure their sugar levels, so they can keep an eye on it to see what's going on. but you know, a lot of our patients can't afford it sometimes. So, but they do come in here, and we can do it in here anyway if they can't afford to buy their own glucometer. So, what have you eaten this morning, Greg? Have you?
Oh, this morning I had some Vegemite on toast.
7.9. That's still a little bit high. So, is that what you had, Vegemite on toast?
I had a meat pie.
Well, once the patients attend the service, you know, it's usually a team approach. We do have a lot of our visiting specialists coming, like a podiatrist, a diabetes educator, so that's all done. But as for the eyes, we need to send them out.
So you book me for a week's time?
I'll book you in for a week's time with Heather.
So I'll see you in a week?
Yeah. We can only do so much as health workers. Most of it we try and encourage it, put it back onto the patients themselves, like for self-management, by buying a glucometer, checking their sugars, having regular checkups, making sure they're taking their medications. I'll see you next week.
Thanks, Louise. Thanks a lot. Have a good day.
We still have a lot of our patients that have gone down the track and, you know, ended up on dialysis. It'd be so nice to catch these patients early before it gets to that stage, I suppose.
After all, I know things not 100%, but at least I'm still going to be here for as long as I can, and with the help of the Aboriginal health workers here.